think so. Perfect. Okay. All right. So, as Jessica mentioned, my name is Kathryn Bautista. I'm a physiotherapist, and that is what I'm going to be presenting on today. So, I'll start by telling you a little bit about myself. Right now, I work at Wedgewood Physiotherapy, which is a private clinic here in St. John's. I grew up in St. John's, and I've been fairly active for most of my life. I used to be a gymnast, and then in high school, I started doing track and field, and now I do a little bit of track and field coaching as well. I graduated from MUN with a Bachelor of Science in Biology, and then I went to the University of Toronto to do a master's in physiotherapy. I love being outdoors, I love spending time with my family, and I also play a little bit of music. So when I started university, I knew that I wanted to pursue a career in healthcare, but I wasn't exactly sure what that was. I also knew that I didn't think I wanted to do medicine. My dad is a doctor, my sister was in med school at the time, and from the exposure I had gotten to medicine at home, it didn't look like it was going to be the career for me. But I wasn't really sure what other careers were out there. But I did know that I did like science. So I started by doing the suggested courses for first year students in the Faculty of Science, and then I declared my major as biology after my first year. Then during my first year of university, I had been receiving physiotherapy fairly regularly because I had been in a car accident in grade 12. And, I had been to physiotherapy before as an athlete, but this was a little bit longer and a little bit more extensive. So having that experience of being in physio for such a long time made me appreciate the problem solving and the diagnosing aspects of physio, which got the ball rolling as a potential career option for me. So there are a few things that helped me to decide whether or not to apply to physio school. I started doing some research to learn more about physiotherapy and the types of places physiotherapists could work, and then trying to figure out if I could get any exposure working with physiotherapists in some of those areas to determine whether or not it was a job I'd want to do for the rest of my life. So I started volunteering as a friendly visitor at the Miller Center on the stroke ward, visiting patients who had strokes and who were undergoing extensive daily rehab programs with a healthcare team, one of those members being a physiotherapist. And that led me to start helping out with an exercise program on the same floor at the Miller Center with outpatients with multiple sclerosis and other mobility issues. I also reached out to my physiotherapist at the time and I told him I was interested in physiotherapy, and he offered me a job at the clinic as a physio aide. So I was able to get a little bit more work experience there in a private clinic setting. I also shadowed a physiotherapist at St. Clair's for a day in the knee gym. So these experiences weren't only valuable in helping me solidify my decision to do physiotherapy, but it was also important for references and for the applications themselves, because oftentimes in these applications, they do ask you about your knowledge of the profession. So whether or not it's physiotherapy or another profession, trying to gain as much experience as you can and doing your research is important because then you have a better idea of what you're getting yourself into. So, what do physiotherapists do? Well, according to the Canadian Physiotherapy Association, physiotherapists are primary healthcare providers with a significant role in health promotion and treatment of injury and disease. We combine an in-depth knowledge of the body and how it works with specialized hands-on clinical skills to assess, diagnose, and treat symptoms of illness, injury, or disability. One big thing that many people don't realize about physiotherapy is that our scope of practice extends beyond treating arms, legs, backs, and necks. There are different types of physiotherapists who work in different areas of clinical practice in a variety of settings. So I thought it would be helpful for me to highlight some of those key areas today just to give you a little bit of an idea of the different things that a physiotherapist could do. Okay, so first one, cardiorespiratory physiotherapy. So physiotherapists in this setting work with people who have heart and lung conditions. So you could see them in places such as cardiac rehab programs to safely return to exercise after a heart attack, in a hospital setting working with patients in the ICU or acute care, or with patients with chronic conditions such as COPD, cystic fibrosis, or even things like asthma. Depending on the condition and the setting, they may work on things such as deep breathing to help with lung volume, managing shortness of breath, exercise prescription, or secretion management in conditions where a patient may have a lot of mucus buildup. Physios would also help patients in hospital setting move safely while in hospital with activities such as walking and moving from their chair to a bed, prescribing mobility aids such as walkers and canes, and preparing patients for discharge. Okay, physiotherapists can also work with patients that have a condition or injury that affects the brain or nervous system. So some common examples would be patients with Parkinson's disease, multiple sclerosis, those who have had a stroke or spinal cord injury, vestibular conditions, and concussions. Because many of these conditions often affect how a person moves, the primary goal is often to help restore functional mobility, normal movement patterns, and quality of movement, which basically means improving the way that they move and do the things that they do every day. So I do some neurophysiotherapy here at our clinic. So some examples of things that I've worked on with patients would be working on the quality of their walking and their walking speed, relearning how to do daily activities like getting out of bed and putting on jackets, socks, zipping up zippers, and teaching wheelchair skills. Orthopedic physiotherapy is usually the one that people are most familiar with. It involves the assessment, diagnosis, and treatment of orthopedic conditions, so injuries involving bones, muscles, tendons, ligaments, and joints. So common examples would be muscle strains, ligament sprains, or things like tendonitis. These injuries may also have a form of nerve involvement, such as when a bulging disc would impinge on a nerve. So sometimes you can also have these types of injuries with nerve involvement as well. Physiotherapists may also see patients after they have surgery, like a hip or a knee replacement, or after an accident. So treatments in this setting that you might get may include hands-on work at a specific joint of the body, which we call manual therapy, exercise-based treatment, soft tissue release, acupuncture or dry needling, and modalities such as TENS or ultrasound help decrease pain or reduce inflammation. Pelvic floor physio is an area that's becoming more and more prominent in our field. It involves the assessment and treatment of conditions involving pelvic floor dysfunction. So while it's thought of an area that's primarily for postpartum women, pelvic health physiotherapists treat people of all genders and ages. It's an area that you have to have special training in after you graduate. So, when you're in school, you wouldn't learn a lot of, other than the fact that pelvic floor physiotherapy exists, you wouldn't really do a lot of training for this in school. You have to do courses after you graduate. And that's just because it involves both internal and external exams. So treatment options for pelvic health physio may include exercises to help strengthen, train, or relax the muscles of the pelvic floor, exercises for the deep core muscles, retraining the bladder or bowel, and strategies to help with pelvic organ prolapse. So this is a graphic that I took from the Canadian Physiotherapy Association website. So it illustrates the different clinical practice divisions, which are the different areas that physiotherapists can work. So I didn't go through every area today, so it just gives you a little bit more of a comprehensive picture, I guess, of where we could work. So, as I mentioned earlier, I did my degree at the University of Toronto. When I entered the program, I wasn't sure what type of physiotherapy I wanted to do, but as with every other program at U of T, we had to complete a number of clinical placements during our degree, which helped give me a little bit of a better idea of what I did and what I did not like. So I had the opportunity to do placements at Bridgepoint Active Health, which is a rehab center in Toronto in complex continuing care, at Princess Margaret Hospital on the leukemia ward, cardiac rehab at the Rumsey Center, Lyndhurst Center, which is a spinal cord rehab center, at Wedgewood Physiotherapy, which is where I work right now, and at Toronto Rehab University in the traumatic brain injury unit and the Rocket upper extremity clinic. So I tried to pick placements in areas that I thought I would enjoy, and so that would give me a better idea of what I wanted to do after I graduated. But when I got to the end of my degree, I still couldn't decide what I wanted to do because I liked two areas of practice. I liked both neuro and orthopedic physio. But in the end, I started working at Wedgewood Physio, and I've been working there ever since. And my boss was actually fairly accommodating in helping me start up a neuro practice at the clinic, even though the clinic had primarily treated orthopedic injuries at the time. So I'm able to do both practice areas, which I love. So if I was to give any advice to students applying to physiotherapy, my first piece would be that connections are very important, and that the idea isn't to make as many connections as you can, but make sure that the connections that you are going to make are genuine and meaningful. So for my own personal experience, I started off at this clinic as a patient. Then I worked as a physio aide while I was in my undergrad. Then I was a physio student while I was at the University of Toronto. And now I work here as a physiotherapist. So that's just one connection going a really long way. Make sure you do your research and know what you're getting into. So there was a guy in my class that didn't like making physical contact with people, which every physiotherapist does basically every day, all the time. So try to learn as much as you can to see if it's the right career for you, whether if it's physiotherapy or if it's something else. Even if you can volunteer in an area or shadow for a day, I did find that really helpful when I was trying to decide what I wanted to do. Look up the prerequisites for schools that you might be interested in applying to. So, even if you're on the fence about whether or not you want to do physiotherapy, you at least have what you need to apply, and you won't have to do too much extra in order to do that. Anatomy and physiology aren't always required at all schools, but they're definitely good to have going into the program because they usually assume that you have a wide knowledge going in there. So here are some resources that I thought would be helpful. The first one is the Canadian Physiotherapy Association, which is our national association. The second one is ORPAS, which is the application website you need to apply to any school in Ontario. Below that is the Dalhousie School of Physiotherapy application website. Next is Karen Hertbees, which she's the clinical coordinator and physiotherapy liaison for MUN. So if you have any questions about courses that you might need or any information, then she would be a useful resource to reach out to. And then I've also put my work email on the bottom there. If you do think of any questions after this presentation and you want to send me an email, you can certainly do that. I'll do the best that I can to answer your question. And if I don't know the answer, then I'll try and find someone that can answer it for you. And that's it.
Thanks so much for that, Kathryn. And if anybody didn't snap a picture of those resources, what I'll do is I will copy out all those links and emails, and I'll send them in the follow-up email after the event with the link to the video. So thank you, Kathryn. I actually learned an awful lot about physiotherapy that I did not know existed. I did not know it was as broad as it is. That is super interesting. So thank you for that. We will, if you have any questions for Kathryn, you might want to jot them down for the end. I'm now going to invite Jillian. I'm going to give you your presenter privileges, and we're going to hear a bit more about audiology.
Where is it? Are you able to see it?
Yeah, it just took a second to load, but it is there.
1 second. You've gotten really small on me for some reason. I can't see my presentation. Have I gotten small?
So your screen is the highlight. So that's the very biggest part of our screens. Would you like me to try sharing it for you? It has gone black again on your end.
Okay, that's bizarre. Let me try again.
We're still just seeing black for some reason.
I
I
don't know.
will, I'll try and share it on my end.
Okay.
Is that visible to everybody?
The
Yep, we
only
can see
thing-
it.
Perfect, thank you. So I will present, and if you just want to let me know when to.
Advance?
Yes. All right, so
Perfect.
is it nice and big for everybody now?
Yeah, looks good.
Okay. Well, hi everyone. My name is Jillian Ryan. I am an audiologist. I have been practicing for 19 years in the field of audiology. Oops, sorry. I was very excited actually to be asked to speak today because not a lot of people know what an audiologist does. So here is just some small insight into the exciting path of audiology and what to expect. So you can advance. And again. So why did I choose audiology? Well, I actually attended Memorial. I completed a Bachelor of Science in Biochemistry with a minor in biology. I actually wanted to go into medicine. That's what I had always thought I wanted to do. Was kind of in the process of completing my undergraduate degree and exploring different fields. Applied to medical school, I didn't get in my first attempt and said, well, what am I going to do now? So a friend of mine had mentioned to me about audiology, so I explored it. I did some volunteer work years and years ago. There used to be a school for the deaf located here in St. John's. So I did spend some time volunteering there, and I also spent some time volunteering in the old Janeway years ago, just to explore hospital settings and different aspects of, allied health professionals that are available to kind of solidify my decision to apply to audiology. And then in 2000, I attended Dalhousie University and completed my Master's of Science in Audiology. From there, I fell absolutely in love with the field. Like I said, I've been doing this now for 19 years, and I love coming to work every day. It's an incredibly rewarding field to be a part of. I've practiced in Nova Scotia for about 8 years, as well as in Newfoundland and Labrador, where I am currently practicing in private practice and own 2 clinics, one in St. John's and one in Carbonear. I have worked in various sectors of audiology. One of the exciting things of audiology is that there's so many facets of areas to work in. I've worked in private practice for someone else, much like other representatives who are presenting to you today. And in hospital settings, I've done research for a couple of years and have been published. And then decided to branch out in 2012 to open NewLife Hearing as a business owner, as well as practicing audiologist. I'm going to show you a video now. Oh, yes. So hopefully now, Jessica, this will work. So if you click on why I love what I do, just go back a screen. Did the link. So if you press on the little advanced button of why I love what I do, can you make that screen full screen? And there we go. And then turn your volume up a little bit. And maybe start from the beginning if you can. Oh, it was there. While Jessica's getting that set up, I'll give you a little bit of a preamble, I guess, to this is a patient at NewLife Hearing who was fit with amplification, and it's a little bit of his journey.
Feel if there's any hint of anything wrong, check it, get it checked. The time is critical. You can't wait. You know, and that's where I lost out. When you're not hearing and you're not participating, you're withdrawing. But the feeling with that is, you know, you're angry. And but then, of course, you go down. You feel a little bit depressed about it, and you don't even realize how it impacts you. You know, so for that, so I'm grateful. Because you don't even realize what's happening to you until you actually get these things back on. I mean, you get a map, just the simplest things in life that you were missing out on. Consequently, what's happened now is I'm engaging in more events and more projects. You know, my social life has come back. I just feel better about myself. You don't normally look forward to going to the doctor or to go see somebody, but it's been an easy transition. I actually look forward to coming.
And you can go back there. That's so, you know, I wanted to put the video in just to give that feel of the rewarding aspect of this profession. It's something that never gets old as you do it. Like I said, I've been doing this for 19 years, and the feeling of impacting someone's quality of life is just remarkable. It's so exciting to be a part of that. If you can go back to the presentation. There we go. And this is actually in this picture, this is my team. We have 2 other audiologists that work with us, our front staff as well. So it is a very rewarding field to be a part of. And we all kind of love taking part in that path of journey to helping someone hear better. So you can advance. So what exactly do we do? And I often tell this story when I have students who I take on a regular basis for clinical placements. When I first finished my undergraduate degree and I moved to Halifax to attend Dalhousie, friend of mine was also studying at Dalhousie, and I said I was going to be an audiologist. And his response to me was, "Oh, so you're learning how to set up audio visual equipment?" And I said, "Well, you don't need a master's degree to do that." But it's quite funny in that, you know, often when I explain what I do, very few people know what an audiologist does. Yet we have such an impact on our patients' lives. Simple things as learning to listen to sounds again around us in various aspects of our field. So at any opportunity, such as being asked to do something like this, I jump at the opportunity to express what it is that we do. So in the profession of audiology, we are hearing health professionals that diagnose and manage hearing loss, tinnitus and its related disorders. So that can include such as sounds in the ears that no one else can hear, hyperacusis, misophonia, which are all sensitivity to sounds, and other auditory disorders like balance, central auditory processing. These are all aspects of facets of audiology that fall under our scope. So like I had said before, there are many, many roles in audiology. We can be licensed practitioners, such as myself. We can work as managers, and managers in the healthcare sector, whether public or private, as well as with hearing aid manufacturers, more in the business aspect or business side of our products available to us for treatment of hearing loss. So we can be those business professionals such as owners, researchers, and much more. The facets and areas of audiology is ever growing. As technology is changing so drastically, you know, our field evolves very quickly. Hearing loss is cradle to grave. You know, it starts with the infant hearing screening program that's available through the Janeway Hospital here in St. John's, all the way up to treating hearing loss for seniors living with dementia. Our field is ever changing because it's very technology focused. We are now looking and engaging at expanding our scope of practice with regards to cognitive screenings with seniors. We know that an untreated hearing loss is highly correlated with the risk of dementia. Actually, an untreated hearing loss is the highest modifiable link to dementia. So cognitive screenings are now becoming a vast part of our process or our scope of practice. Technology advances are forever changing, whether that's down to treatment with regards to hearing aids, which change now every year, advancements with Bluetooth technology and helping patients to hear and understand speech much better, and even technology advancements with regards to diagnostics of our field, how we're treating, how we're diagnosing and administering those tests to our patients are ever changing, and as well as with cochlear implants. And one of the reasons that I decided to become an audiologist through my volunteer experience was because of that field of cochlear implantation. We've all seen those wonderful videos of, you know, seeing children hear for the first time. It's so exciting to be a part of that in some small way, with sharing it with those families, and even with our seniors who are on that process with adult implantation. It's been just such a rewarding part of my career. I still do some implants as part of my private practice, and it's a field that is forever changing, and it keeps you day to day doing something different, which is what I love. After 19 years of practicing as an audiologist, you never want it to be the same day in and day out, and audiology certainly is not that. So you can expand forward in the presentation. So again, what we do, we screen, assess, identify, and treat hearing loss, auditory processing disorders, tinnitus, and other auditory disorders such as balance. We also are strong advocates for the prevention of these disorders, such as, you know, working with Department of Veterans Affairs, working with Workplace NL to prevent hearing loss and damage to our ears. We can work independently or as part of interprofessional teams within various private, public, you know, hybrid organizations where it's a little bit of both. These can include hospital settings, public, private practices, universities, schools, research centers, rehabilitation centers, government agencies, manufacturing companies, and other type business aspects in the cochlear implant world. You can go ahead. So there's several universities across the country in Canada that offer audiology. Way out on the other coast is University of British Columbia, Western University in London, and Dalhousie in Halifax. And there also is a French program at University of Ottawa. The minimum is a master's degree to practice audiology within Canada. The United States is currently offering a AUD program, which is a doctorate of audiology. Something actually that after my 19 years, I am enrolled in now, starting at the University of Arizona. Entrance into the university programs in the United States is actually, they've gotten rid of the master's level and it's more in that AUD processing. However, in Canada, the minimum to practice is still a master's degree. So words of advice, you know, much like Kathryn had said, you know, finding what you want to explore and do, you know, you have to really dig into the aspects of what the field is. And, you know, we are largely involved with very intimate details with families. You know, our sessions, our counseling sessions can be very in-depth at times, and most times it's sometimes not focused on necessarily hearing. So, you know, I do strongly recommend observing and volunteering with some audiologists in various sectors of the field, whether that's through the public, which is, you know, more diagnostic than rehabilitation, private practice, which focuses more on rehabilitation audiology, to really get a feel and be a part of your role with regards to being an audiologist with these families. I also recommend prior to entrance to volunteer with some non-for-profit groups. You know, a lot of programs like you to be very well-rounded, you know, take part in activities within your community to really get a sense of that, you know, who you are as a person and kind of contributes to your application. And most universities are looking for that these days. You know, as a student and as a professional audiologist, I often like to give some little tidbits. It is a very small industry, and make sure that your clinical placements really do count. My first job that I received was at Nova Scotia Speech and Hearing Centers in Halifax. And when I was interviewing for the job, the supervisor who I would be reporting to was actually friends with my clinical placement in Calgary. I did my final rotation at the Calgary Children's Hospital, and they were good friends. They had gone to school together. So when I had interviewed, the supervisor had asked me about my placements, and then she actually reached out to that clinical placement, which I had at that time about 9 supervisors. So it was a very small role, but still those impacts count. So, you know, I really appreciate Kathryn and her words of advice in saying that it's quality, not quantity. Make sure those connections really count because they do it's a small industry. In many aspects, the world is smaller than we think it is. So those words of, you know, praise, I guess, from that supervisor really did help me get that first job with regards to Nova Scotia Hearing and Speech Centers. You know, I do also recommend to take an interest in your field and read up on trends and advances. It's important really to stay current in any field of health, especially when it's so focused on technology, much like audiology is. You know, be that advocate for your profession, be a part and engaged with your college and licensing board, and explore many facets of audiology. You know, I often will give advice to students when they graduate, take jobs in many fields to really get a sense of what you love. And sometimes you're lucky enough to be able to do a combination of both. I love rehabilitation with regards to hearing loss. Working in private practice has certainly helped that. And I still get to do implants as part of my private practice work, which is wonderful. There are two areas of audiology that I love. And only because of my experience in exploring different jobs that I was able to understand more deeply what I wanted to do and what I love to do, so that I can pass that passion along to my patients and improve and help be a part of their improvement in their quality of life. You can advance. So here are some resources. The first one is the Canadian Academy of Audiology. Many people sometimes think that audiologists and speech language pathologists are the same, and a lot of times their programs kind of coexist. Very different professions. They really only the similar aspects is that, you know, we go to school together, in that it's learning about communication and how to help our patients communicate at their best, whether that's language or whether that's hearing. But they are very, very different fields in a lot of ways. So I do like to put forward the Canadian Academy of Audiology. It is our national organization. That gives a lot of research or a lot of information with regards to the field of audiology, just to itself. Speech Language and Audiology Canada is also one of our national organizations that encompasses both professions. The Newfoundland Association of Speech Language Pathology and Audiology is our provincial association. We are licensed to practice and are registered within the province of Newfoundland, and that is our college. I actually sit on our college board. I have been an active member of our licensing board for 10 years. And this website is great because if and when you do decide and graduate from a field of audiology, it gives you some insight into how to get your license in practice. Lots of regulations and bylaws and things you can read up on, scopes of practice. And of course, I did list my website. It gives you an idea of kind of what it is that we do with patients to help improve their quality of life. Much to the video that I showed, there are plenty more on there. Just to give a sense, I picked that particular patient because it was such an emotional and feel-good type of video, but there are tons of videos on my YouTube page that you can certainly have a look at as well. And of course, my email is jillian@newlifehearing.ca. If you have any questions, certainly feel free to reach out. And if I can't answer them, I'll certainly find the right person who can. And I hope it was helpful in learning a little bit more about audiology.
Thank you so much, Jillian. Again, I'm learning lots and lots here today as well. My background's in mathematics, so this is really eye-opening for me as well. So once again, I will share those links and emails in a follow-up email that I'll send you either tomorrow or early next week. So now I'd like to invite the Eastern Health team to come share their screen. So I'm going to pass presenter privileges over to Susan.
Sarah.
Sarah, sorry, I was right the first time.
Before I introduce myself and Susan introduces herself, I'm just going to bring up a quick live feed for you. Just to kind of let you know why the cancer care program is growing and in need of some interested parties for the cancer care careers, and why this is so important for us. So just a quick glimpse on the West Coast, we've got a brand new hospital going up. Can everybody see that? Good. All right. So just a look. So Susan and I are both radiation therapists, and right here we've got a brand new radiation therapy bunker going in the brand new hospital in Corner Brook. We have a radiation therapy center in St. John's as well. So this is kind of why these career tracks for us are really important in bringing specialized professions to Newfoundland, and why we need you to know about this profession. So I'm just going to bring up our presentation here now. All right. Okay. Everybody see that in presentation mode? Okay. All right, so I'll introduce myself. My name is Sarah Humber, and I'm just going to flip the slide here, if I can get it to move. There we go. So I actually grew up in Newfoundland, in Lark Harbor, so a small fishing community outside of Cornbrook. In 1997, I moved away to do my BSc in biology. In my third year at Acadia University, I was kind of, it's similar, you know, to the mindset of Kathryn and of Jillian, trying to figure out where I was going to go with my biology degree. Initially, I thought that I was going to end up in teaching, but then I kind of started exploring and looking around to see what I could find. In my third year of my biology degree, I did find radiation sciences at U of T, and there's no looking back from there. I successfully completed my radiation therapy degree, and I worked at Princess Margaret Hospital in Toronto for several years, and then I moved outside of downtown Toronto to kind of raise a family, and worked at another cancer center in Oshawa for quite a number of years. Presently, I'm currently working on an enhanced radiotherapy and oncology practice master's. And I'm also involved in the project management and the build of the new cancer center here in Cornbrook.
Am I unmuted?
Yep, you're good.
Yep.
So I'm Susan Costello. Nice to see so many people on board here this morning. I grew up in Newfoundland as well. Sarah and I actually attended the program the same year, which is a little bit of a coincidence. But I was here at MUN in my first year of general science studies, and actually a family member of mine was working in the cancer center. She was a registered nurse working under the radiation oncologists, and she called me and she said, I found a career for you. It's a science background, sort of geared toward math and physics, but it has a lot of patient care involved. So back then they would put ads in the Newfoundland in the Evening Telegram, I think it was at the time, and they were paying for tuition and books for anyone who would go do this program. So I signed up and went through a bursary program where my tuition and books were paid for, and I had to sign a 5-year return in service contract to come back and work in Newfoundland when I finished, which was fantastic at the time. And a lot of my high school friends were struggling to find work in Newfoundland, and I had my university paid for and walked right into a job here. And they say everything comes in cycles, and it looks like we're back to the same scenario here now. We'll get into it further in the presentation, but we are offering to pay for tuition and books for students to do this program. We're going to be in desperate need of radiation therapists in the coming years. So when I finished the program, I worked at the H. Bliss Murphy Cancer Center as a frontline radiation therapist from 2004 to 2019. And since 2019, I've been the division manager of the cancer care program. So we're really excited about the new linear accelerator that's going to be installed in Cornerbrook, Newfoundland. But with this expansion of the program, we are going to need people to do this career. So I'll let Sarah get started in telling you all a little bit about what radiation therapy is. I'll get into some of the human resources and what university credits you need. And then we'll also give you some information on medical physicists as well, because we will need some of those for both St. John's and Cornwall.
All right, so our profession is very diverse. We have a lot of lateral transitions and lateral movement within our profession, which keeps it interesting all the time. For those of you who don't know what radiation therapy is a cancer treatment that is used to kill cancer cells. It simply just destroys the cells by destroying any genetic material that grow and divide and cause those cancer cells to replicate and divide within the human body. So our goal as radiation therapists is to take a prescription from a radiation oncologist. We develop a plan, and physics will QA that plan, and then we will load it into our linear accelerator, and we will try to destroy those cancer cells while minimizing the damage to the normal tissue. The role of a radiation therapist, like I said just then, it's very, there's a lot of lateral movement within our profession with a lot of different ways to kind of bring out what your interests are. We are highly technical. We have a lot of big equipment, but at the same time, we have a lot of software programs, and we also have a lot of invested in patient care, patient education, a lot of hands-on work. Having said that, we can kind of transition between all of those things to kind of have a diverse array of what we can actually do. The treatment delivery. You can see up here in the corner there's a linear accelerator. We call it a LINAC. It's a large machine that's electronically operated, and it produces radiation. So we will create a plan for each individual patient of where we need to treat. And what we will do is put that patient on the bed, the exact same position every day, and deliver radiation to the area that the oncologist wants us to treat. So we use very, very high energy x-rays or electrons to the region of the patient's disease. So this is not simply an x-ray. This is very, very high energy. We also incorporate a lot of patient counseling and assessment on the possible side effects from these treatments, and we use all the resources from a multidisciplinary team to make sure our patients are feeling like they're going through a scenario that we can better their journey. We also do the treatment planning. So we have one big machine would be the linear accelerator. We also have a CT simulator. So we also operate CT scanners. In this, you can see in the picture here, what we do in the CT simulators, we actually position the patient on how we want them to be treated. So when we get them into that position, we will put markings on the patient to keep them in a stable scenario and reproduce that setup on a daily basis on the linear accelerator. So you can see that technology for us is very, we rely on it, and our patients are getting very good treatment because we can actually see what's going on in the inside. The other very interesting part of our profession is that if Kathryn had stated that she had I guess a student that went through school with her and didn't like to touch people. Well, with radiation therapy, we kind of have the luxury of having background as well. So here on the right-hand side, you can see computer software, computer programming. We actually develop the plans for the radiation treatments for each individual patient on software. And these people are actually called dosimetrists, which are just radiation therapists, lateral movement, kind of move up the scale a little tiny bit, and can develop the planning for the radiation therapist to treat on the machine. There is still some patient contact, but the role here is to strictly develop some plans and QA for the patient. So there's a lot of measurement, calculation, assessment of ionizing radiation, and also it involves a lot of physics, math, and biology, as you can imagine. So this is just, again, a quick picture here. I just thought I would pop this up. So the provincial cancer care program, Corner Brook, St. John's, we are, like Susan said, we are going to be in desperate need of radiation therapists in the coming years. And the goal is to kind of, make sure we have the right staff in the right places at the right time, obviously. And we'll be opening our center here in Corner Brook in 2024.
So a lot of questions, I guess, when you're in university is, what type of a job is this? What sort of a salary will I make? What prerequisite courses will I need for admission, and how long is the training? So I'll go through some of that information now. All of the radiation therapy positions in Newfoundland and Labrador fall under Eastern Health. We are a provincial cancer care program. So there's no private industry with us. They're all unionized positions in a NAPE LX union. So anyone can look up a NAPE LX contract and have a read through if you're interested. But just to sort of summarize some of the key points, the yearly salary for a radiation therapist starts at 56,292 and goes up to 95,18. It's 35 hours work a week, which is not too bad. A lot of the jobs in healthcare are 37 and a half or 40. And in addition to this base salary, there's a market adjustment that is currently set at 12,148. That's paid in 2 lump sums, but it essentially brings us up to an equal market with the rest of Canada. I know a lot of health professions in Newfoundland aren't on par with counterparts in other parts of the country, but the radiation therapy positions are. And we'll go to the next slide.
It just froze up a little bit,
Sarah. Sorry,
No, no.
I'm trying to click on my page.
There we go.
So as part of a unionized position, once you're hired by Eastern Health, there's a lot of other benefits, not just the salary, that come with these positions. There's group insurance for individuals or families that includes, say, massage, chiropractor, physiotherapy. There's dental you can have for an individual or family. There's also options for long-term disability, critical illness, accidental death and dismemberment. All of the provincial government, we pay into the same pension as, say, provincial government employees. So there's a public service pension plan available. You also start with 4 weeks paid vacation a year, which is quite good. And after 10 years of service, you get an additional year. So for the last 10 years, I've been getting 5 weeks vacation a year, which is quite good. There's also 1 day paid sick leave per month that you can save and accrue for if you ever need it later in life and you had to take an extended absence from work. You can build up your sick leave and get paid if you had any extended sick leave at any point in your career. And there are also right now three family leave days a year for employees. So there's quite a lot of benefits that come along with working in a health-related field. Some of the other, I don't know if we have it in a slide here, but some of the other nice things about a career in radiation therapy is that we're a Monday to Friday, sort of an 8 to 4, 9 to 5 job. We do on call. There's 2 therapists of the 30 we have on call. So once every 3 to 4 months, you do 1 weekend on call. But it's a pretty nice job. There's no overnights, no routine weekend work. It's a great career. Next slide, please. So as I mentioned in the beginning, we currently have educational opportunities for anyone who's interested in a career in radiation therapy. We are hoping to we have 3 students currently enrolled. Unfortunately, the deadline to apply to attend this September has just passed, but for anyone who would be interested in starting the program in 2023, you can apply to the Michener Institute for the radiation therapy program. And I believe it was around December this year, we posted the bursary opportunity through the Eastern Health Job Board that anyone could go online and apply. And that would be to have your tuition and books paid for. And it would be on a condition that you would work in Corner Brook. I can't remember if it was a 4 or 5 year return in service contract. And outside of this opportunity to have your tuition and books paid, we're expecting there to be plenty of positions both in Corner Brook and St. John's in the next 10 years. Right now, I think I said there's 30 radiation therapists in the entire province of Newfoundland and Labrador. We will have to add 8 upon opening of Corner Brook, and we expect it will take several years to be able to fill those 8 positions. I have 5 therapists who within the next 10 years will retire, and we're currently in a situation right now where there haven't been any Newfoundlanders graduate from this program in the last 5 years. So the positions that we post are routinely filled from students who come from other provinces in Canada, and the trend has been that they come to Newfoundland, work for a year, get some experience, and then they have enough experience to get work back in their home province. So the turnover has been quite high for the past couple of years. So we're really hoping to get a stable workforce where people come and stay, and the experience that people gain stays right here in the province for the patients and people of Newfoundland and Labrador. Next slide. Oh, I missed the prerequisites. Hang on. Sorry, Sarah.
No worries.
So you don't have to have a degree to get into the radiation therapy program. The prerequisites right now, it has changed over the years of the program. So I'd recommend double checking on the Michener Institute for Applied Health Sciences site. But right now it's a minimum of 1 year of university with courses in biology, math, physics, and a social science with a GPA of a B- or above. So that's to get into the Michener, and then we can go to the next slide.
And I think
So once you're in the program, it's a three. Yeah, go ahead. Oh. There. Once you're in the program, it's a 3-year program. Do you want to say something, Sarah? I thought I heard you say something. No? Okay. Once you're in the program, it's 3 years, but it's actually only 4 semesters that you would have to go away for. So the first year starts in September with didactic learning. So the fall and winter semesters would be in Toronto. And then you would come home May and June and do an 8-week clinical placement here in St. John's at the Cancer Centre in St. John's. The second year again would be 2 didactic semesters in Ontario. So the fall and winter semester. Then you would have May, June off, and you would start in July for a 10-month on-site clinical placement here in St. John's. Sarah and I both went through the same program. One of us went through the bursary, one without. We're both ending up after 20 years in the same place, which is great. But it's a fantastic career. If I had my time back to do my life over again, I would never have picked anything else. We're a small, tight-knit group that we get along really well. We work really well together. It's a career in healthcare where if you're math and physics and science at heart, but you really want a career in healthcare, this is really the career sort of for that type of person. We're all, there's a lot of quality assurance, a lot of math, a lot of physics, but the patient care side of it is what sort of draws people into the field and keeps us here. And it's a really nice, the Cancer Centre, the cancer care program in Newfoundland is phenomenal. The patients are so appreciative. I can't imagine having done anything else. And we have a slide here as well. A lot of university students ask about transfer credits. You can, if you only have 1 year finished, because it's a degree and a diploma program, you can't transfer any credits if you're going to go after your first year of university. But if you have a degree finished and you have, say, a physics, so not the physics, but if you had an anatomy or physiology already completed, you can probably transfer some credits. But I would highly recommend, if you're in the program, it's only 4 didactic semesters. I would do all of the courses. Most of them are geared toward a career in radiation therapy. And I actually came, I was in the kinesiology program before I went into radiation therapy. So I had my, most of those first year courses, I had done them at MUN, but I did them again in Toronto and I'm really glad I did.
All right. In the interest of time, I'll shorten this up a little bit. So there's another profession. This one's a little bit more intricate, medical physics. So if you are a math-based, physics-based person and you're looking for what your opportunities may be in the future, medical physics is definitely a good one. I'll give you a quick overview, but if you want any more information, by all means, please reach out. The medical physics side of things, more of a QA role and not a patient care centered focus, aside from developing programs in the background and making sure that we're keeping up with techniques and on par with the rest of Canada. The radiation treatments, all the plans that are developed and approved by the oncologists are also approved by medical physicists as well, to make sure that that dose modeling is accurate for the patient's treatment. There's a lot of QA involved, but also the safety. You can imagine for a radiation therapy center, it is not a private sector in Canada. It is a public and typically located around hospitals, and it is federally governed by the CNSC. So it's a medical physicist role in this profession, in this area, in the cancer care program is very big, and we wouldn't be able to operate without them, literally. Just, you know, becoming a medical physicist is a very long journey, a very rewarding one, but a long journey. It requires a PhD in medical physics and a residency as well. So if this is something that is an area of interest for you, please, by all means, let us know. We have our chief medical physicist at Eastern Health would be more than happy to answer any questions, as well as Susan and I. And again, that's just a quick look at the compensation for a medical physicist. And again, in the interest of time, if you require any more information, please let us know. This is a multidisciplinary healthcare team. We have a lot of people in our system that makes the system work in cancer care. And these are just kind of a list of other areas that you may want to pursue if radiation therapy is not your interest. We have, as you can see, a broad range, right from biomed, dietitians, social work. It's a very multidisciplinary healthcare team. Lots of resources, and I'm sure we'll have those out to you, and it would be in the video as well. But again, reach out if there's any information that we can give you. So, Susan, do you have anything else to add?
No, I think that's good, Sarah.
All right. My mouse here.
Another packed presentation with so much amazing information. Thank you for that, Susan and Sarah. The multidisciplinary team part of the presentation was quite interesting. You see how many professions go into treating cancer, and that there are lots of career options to move into public health. So without further ado, thank you again, Susan and Sarah. I'll invite Cassidy to let us know a bit about genetic counseling.
Okay, you guys can see that? Okay, awesome. So I will have a couple polls throughout using Poll Everywhere. So if you want to just text this to 22333 while I'm beginning the presentation, that would be great. So just an overview, I will be going into a little bit about my journey and how I found out about genetic counseling. What is genetic counseling? A couple quick case examples, and the admissions requirements and the genetic counseling schools in US and Canada. So how much do you know about genetic counseling? So feel free to answer. I just have 3 choices here just to kind of gauge how much everyone kind of knows about the field. Okay, cool. I see some answers in the chat. That works too. Okay, awesome. So would anyone consider a career as a genetic counselor? Okay, cool. So a little bit about me. I graduated with a Bachelor of Science in Biology and a minor in Biochemistry in 2018. And much like the other panelists, I was very lost on what to pursue. I originally was interested in dentistry, and I actually applied and didn't get in during undergrad. So I went back and took an extra year to complete the honors portion of my degree, where I studied genetics of ankylosing spondylitis. So I worked within a lab within the Faculty of Medicine under the genetics department. And that's kind of where I discovered genetic counseling and fell in love with the field of genetics. So I started researching the career of genetic counseling. I realized I had a lot of work to do in terms of gaining appropriate experience. I wanted to shadow a genetic counselor and make sure that that's what I wanted to do. So I actually decided to pursue a Master's of Science in Medicine and Human Genetics within the same lab I completed my honors project in. So I'm currently trying to finish that up at the same time as currently also a genetic counseling student at Sarah Lawrence College in New York. So what are genetic counselors? So genetic counseling is they have specialization in medical genetics. They guide and support patients seeking more information about how inherited diseases and conditions might affect them or their families, and interpret genetic test results based on their personal and family history. So genetic counselors are a little bit unique in that they have expertise in counseling as well. So we provide emotional support to patients as they make decisions about their genetic health care. There's typically specialties, so we call them the big three, are cancer, pediatrics, and prenatal. But there are some smaller areas that are up and coming, such as cardio, neurogenetics, research, industry. We do actually have a cardio genetic counselor in Newfoundland, so it's kind of a big field in Newfoundland right now. You don't go into specialties throughout your training, but typically when you get a job, you're kind of hired as a certain type of genetic counselor. I had this before, but in the interest of time, I'll just skip through that and I'll go right into a quick case example. So Claire is referred due to a family history of breast cancer. So breast cancer can be a form of hereditary cancer syndrome. So there's certain red flags we look for in a family history. So Claire would come in for an appointment. We would take her medical history, learn a little bit about her background, has she had anything show up on a mammogram before, anything like that. And then we would take a pedigree. So I'm sure most of you have taken genetics so far and know what a pedigree is. So we would draw her family history out and see if there's any kind of patterns in the cancer that we see. So some red flags for breast cancer might be a male with breast cancer in the family, more than one relative with breast cancer at like a young age, so typically before the age of 50, cancer in more than one organ, and then we would kind of, based on that information, determine if they would be eligible for genetic testing and help them decide if that's something they would like to pursue. We would counsel them on that, and then we would set up another appointment with their genetic testing results and go through the potential options that they might have depending on the results. So if it was positive, for example, for hereditary cancer syndrome, we would typically set up testing for more family members if they're eligible, begin management, so more screenings for individuals with a certain mutation. And then if it was negative, we would probably continue screening for the individual a little bit more frequently than the general population, just because they did have a strong family history of cancer, but we wouldn't be as concerned as with a known mutation. And then another example, so say Claire is also currently pregnant and she's 38 years old. So this is what we call AMA, or advanced maternal age. So as you get older, you are at risk of having more chromosomal abnormalities through your pregnancy. One that everyone's pretty familiar with would be Down syndrome. So you would have an increased risk of having a child with Down syndrome as you age, like the graph shows. So we would do a very similar thing, but this would be more of a prenatal appointment. We would take her medical history, determine if she had any history of like miscarriage or something like that. Take her pedigree, determine if there's anything concerning within the family, any diseases running in the family that might put her and her pregnancy at a higher risk, and then counsel her on her options for her pregnancy. And likely in this case, you would suggest an amniocentesis, which will give an early look into the fetus's chromosomes. And then depending on the results, we would counsel her say that the fetus's chromosomes did come back to have a chromosomal abnormality, we would discuss the options for her, whether continuing the pregnancy or potentially terminating, depending on what they want to do. So why genetic counseling? So for me, I just loved the field. It seemed like very much kind of like a puzzle. You're trying to figure out, are they eligible for testing? A lot of the pediatric appointments would be kind of finding a diagnosis that might fit. And from what I had shadowed, it seemed like genetic counselors made a really big impact on their patients' lives. It's a super interesting field, and I do love a challenge, so it was something that I was really interested in. Also, I just pulled these stats from the survey they do every year from the genetic counselors survey. So an average salary is about $95,000. I think the starting salary average was like 75, but it varies largely depending on where you live. This is a survey done in the United States and Canada. And 90% of genetic counselors indicated they were satisfied with their profession. So what you need to get into genetic counseling school, so it is a master's program, so you do need a Bachelor of Science. I believe there are people in my program that don't have Bachelor of Science, but you would just have to make sure all the prerequisites are done. So they're typically biology, biochemistry, organic chemistry, psychology, things like that. A lot of programs require some type of counseling experience. It's a really important role in our job, so some exposure to that before applying is really helpful. Advocacy experience is also great, but honestly, just find something you really enjoy doing. And then they also really want you to be exposed to the field of genetic counseling just to make sure that it is something that you want to pursue and are familiar with. So there are 4 programs in Canada. Each of them take about 5 students a year, so about 20 students a year in Canada. So they're at University of Toronto, McGill, University of BC, University of Manitoba, and then there's 50+ programs in the United States. So my program that I'm at actually has 27 students, so my one program takes more than all of Canada. So in Canada, it's a really, really competitive field. And then a little bit about my admissions journey. So I had my Bachelor of Science when I applied, and I was also currently completing a master's when I applied. I volunteered at Planned Parenthood of Newfoundland and the Newfoundland Sexual Assault Crisis and Prevention Center for a couple years. I also did text line with Kids Help Phone and was a big sister at Big Brothers Big Sisters. I have Planned Parenthood and the Sexual Assault Crisis and Prevention Center crisis line highlighted because I think those were very, very valuable experiences for anyone that might be interested in this field. I learned so much there, and I still use a lot of the things I learned there in school right now. And I honestly just thoroughly enjoyed both of those experiences. So it's something to look into if you are interested in the field. I also volunteered at the Provincial Medical Genetics Program for 2 years, where I drew a lot of pedigrees. I observed about 5 cases, which was kind of interrupted by COVID. But I was able to see some cool stuff, so that was really interesting. And I applied to 10 schools. Last year, I got interviews at 6. I got interviews at all the Canadian programs, as well as 3 US programs. And genetic counseling uses a match process. So similar to medical school residency, you rank all of your choices. The schools rank everyone they interview, and then it's kind of like this big algorithm that figures out where everyone fits. It just avoids a wait list, basically. So I matched to Sarah Lawrence in New York, and that's where I am now. Really enjoying the program so far. So my final words of advice is if this is something you're actually really interested in, go for it. I know I was really hesitant to kind of jump right into this field because of how competitive it is. Everyone told me they only take 20 people. In Canada, it's going to be so hard to get in. But honestly, it was something I really, really wanted to do. So I'm no regrets on that. But I will say volunteering at those places that I really enjoyed really helped because it didn't feel like I was just showing up to hopefully get a reference letter in the future. I love the experience, and that's my biggest piece of advice. And then also, I know how stressful it is to not know what to do or to be thinking about applying to grad school and thinking about if everything will work out, but it will eventually. So try not to stress about the whole process. And please reach out to me if you have any questions about the field. I love genetic counseling, and I love talking about it to future students. I added a couple of resources. Find a genetic counselor will help you get in contact with genetic counselors near you if you wanted to reach out. I believe they have like a student contact welcome next to their names if they allow student contact. And that's how I shadow genetic counselor. And then also the website for all the programs in the US and Canada if anyone's interested in looking into them more. And I just have the final questions. You guys feel like you learned a little bit about genetic counseling? Cool. And did I change anyone's mind? Is anyone considering a career now? Cool. Okay, awesome. Well, if anyone has any questions, please feel free to reach out to me.
Awesome. Thank you so much, Cassidy. That was amazing. Lots of info. So what I'm going to ask now is we do have about 10 minutes for questions. If you do have further ones, again, I will send all resources and contact information from those presentations in an email to you so you can follow up if you don't get a chance to ask your question. But we will certainly use the last 10 minutes to take advantage of any questions you may have. So you can type it in the chat or type in the chat that you'd like to ask a question, and I'll call on you to unmute and ask it yourself. Let me know who the question's directed to, please, if you do have any questions. So I will leave it open for questions before we close out. Also, I am going to put a survey link in the chat. Please take, it just takes 5 minutes or less. Please take the few minutes because it helps us improve all of our career programs and services. So your feedback is definitely important in making changes as we go forward. See what we're doing well and what we aren't. So for Kathryn, did you find course-wise physio-based courses were similar or different from those of kinesiology?
So some of the courses I think were similar. I mean, I did anatomy and I did physiology, biomechanics, and advanced biomechanics with the kinesiology program here as electives for my biology degree. I think in terms of like regular course material, you ran out of what you learned in undergrad fairly quickly. So I wouldn't say it made a huge difference in terms of, in terms of the degree, like doing a biology degree versus a kinesiology degree. You learned, I'd say, more new stuff in the program than things that like people would have already known from doing a kinesiology degree. I don't know if that answers your question or not.
Thank you. Cassidy, if you do the GC program in the States, are you licensed to practice in Canada? Or I guess, how do you become licensed to practice in Canada if your program's in a different country?
Yeah, so the American and Canadian programs are like interchangeable, so I could write both American and Canadian boards and can work in either country with that.
Awesome. That's nice and versatile. That's good to hear. It's often pretty difficult to get licensed cross-country. Kathryn, again, why did you choose physio over med school? This is a really good question. In your opinion, what are the benefits, advantages to a career in physio over medicine?
That is a good question. So when I was trying to decide whether or not I wanted to, what career I wanted to do, as I said, my dad is he's an anesthesiologist, and I found that, growing up with a doctor, I was like, well, I'd rather have a job where I can work regular hours, I don't really like the stress of having someone's life on my hands, so that kind of nixed medicine for me. So I liked physiotherapy because, well, the lifestyle worked with a little bit more of what I was looking for. And then we are also just dealing with outsides. I mean, with the exception of pelvic floor physio. Physio is more working on the outsides of people versus the insides. I like the problem solving aspect of physiotherapy, which I guess is similar to medicine. Physio versus medicine. Yeah, I think the big things were lifestyle, and I don't know, it's it's a hard question, but I'm definitely happy with where I am now. In terms of school, it is a shorter academic path. You don't have to do the same amount of school to get into physio, and I think there's more versatility once you get into physiotherapy. So let's say, you know, if I wanted to start cardiorespiratory physio tomorrow, I could. Whereas if you're in medicine, you start a specialty, and you're basically legally bound to that specialty. Once you start it, it's a lot harder to change what you want to do. So you're a little bit more flexible in that regard. Was there any other specific things that you wanted me to talk about, I guess? Like any particular aspects of physiotherapy?
Don't see anything coming through in the chat. That was a great question and a great response. Because I think sometimes that question just doesn't get asked. Medical school is so popular, but there are certainly lots of other healthcare options. And today is just a very small sample of some of those options that are available to science students. Of course, there's further education, but it can help to explore them now so you know where you might want to go later. For Jillian, is audiology something that can be pediatric based? And do you work alongside speech pathology much in your field? You also mentioned preventing hearing loss with working with veteran affairs. Could you expand on that a little bit?
Yes, absolutely. And to add to that previous question, because I know I was kind of struggling with the whole medicine versus one of the things that I find advantageous too is that you, as an allied health professional like physiotherapy, you get to spend a lot more time with your patients. In the field of medicine, sometimes depending on what field you go into, it's usually quick, more, in and out type of visits, versus with allied health professionals, it's usually building long-term relationships with patients, depending again on the fields that you go into, just as a side note.
That's a very good point. I also agree on that.
Yeah. Yeah. And for me, I love spending time with my patients. So for medicine wasn't a good fit for that reason for me, because it would be short-lived in nature. Yes, audiology definitely can be pediatric based. I worked with pediatrics for a large part of my career through cochlear implants, as well as through infant hearing screening programs, fitting children with hearing aids, diagnosing and treating hearing loss, auditory processing disorders. We help in the process with that as well. Preventing hearing loss is a full scope, not just with regards to Veterans Affairs. As an example, we work with a lot of local businesses, RCMP, RNC, in doing preventative hearing health, where we do hearing screenings of people who are enrolled in those job sectors. Monitoring hearing loss for those that work around noise, suggesting hearing protection that's going to work within their field. That's more the preventative kind of working that we do. Department of Veterans Affairs Workers' Compensation, we work with very closely as well with regards to once they're diagnosed with a hearing loss, of treating that loss and working through the rehabilitation aspect of that hearing loss.
Awesome, lots more information. We have about 3 minutes, probably time for one more question. We could maybe squeeze one in if anybody has one final one. So again, we had a very small snapshot of different healthcare professions here. even with Eastern Health, of course, there's lots more to explore, but that focus on radiation therapy, medical physics, and cancer care was really interesting. And I was going to ask where the students could find more information on education they might need to get in that field, but that was covered in the slideshow, and I will share all those resources, links, emails with you. So if there's no final questions, I didn't see any others come through. Thank you so much to our presenting professionals. It's invaluable for our students to get to hear what it's like. And one thing I noticed all presenters had in common in advice was speak to people in the profession, shadow, research. These are all very specific, targeted professions. So I think it's really important that you do your research. You have so much time to really explore what you're interested in. This is a really good question. There is one more question came in, and I was surprised it hadn't come up yet. So this is for Susan and Sarah, and it's just about what are the emotional effects like working with patients in cancer care? Do you find it highly rewarding? How difficult is it emotionally?
I can take that one,
Perspective
Sarah.
is highly rewarding.
Rewarding.
And we also have a lot of resources in place that help us deal. I think there's a little bit of feedback. We have a lot of resources available for staff to make sure that we are debriefed, and we have very close interactions with our patients, and we can see them over an 8-week period of time. So we get to know them very personally. We get to know how they operate, how they work, what their coping mechanisms are, how, even though we may only see them for 10 to 20 minutes a day, we've become a very vital part of their journey in their recovery and healing and their next stages in life. So for us, we rely on each other a lot. Our colleagues, we are very supportive of each other. And yes, sometimes it does become draining cancer doesn't define age. It will pop up at any age group, as we all know. So sometimes you need that little bit of support more so than others. Susan, how about your experiences?
Very similar to Sarah's. It's one of the things I found when I first started a career in radiation therapy is you'd go out somewhere and someone would say, "Oh, what did you do when you were in school? What are you working in?" And I'd say radiation therapy, and I'd get sort of I have no idea what that means. And you'd explain that you work in a cancer center with cancer patients, and people right away, "Oh my God, I don't know how you do that job. It must be a terrible job and it must be so difficult." And I would always say, no, like you do become emotionally attached to the patients, but the reward far outweighs that. I can't say I never came home upset. You do, but I never ever left work wishing I had done a different career. And all the people I've worked with over the years, I don't know of anyone who left the career because of the emotional drain the career caused on that person. You feel good when you walk out at the end of the day. You did something good, you cheered up someone's day, you got them the help they needed. I feel good coming home from work.
I think the big thing is that we're a stepping stone in it's not necessarily the last. We're not the last people that these patients see. So we kind of we're at a moment of hope for them because we're offering a treatment. So the interactions we develop and that safety we provide them at a very vulnerable time. Yes, it can be emotionally draining, and compassion fatigue can definitely play a factor. But having said that, it's like Susan said, it far outweighs.
I'm glad that question came up because I think that is a big part of the job, and healthcare in general. You're always, so close with patients. So that was a great question. So once again, thank you to our visiting professionals for taking the time out of their busy day. I think there was such amazing information for our students here, and they're going to get some great resources and contacts now when I follow up with an email. We have gone a couple minutes over, so I'd like to let you get back to your professional day. So thanks once again for taking that chunk out of your day for our students. It's greatly appreciated, and lots of valuable information here today. Students, please remember to fill out that survey. It's in the chat again there if you missed it, a little link. And thanks to the students for taking time out of their class schedules today. So I'm glad we were able to record this for those who couldn't miss class today.